gonna do a physical assessment. Are you okay with participating?
Yes.
Alright, thank you. I'm gonna wash my hands, which I just did. Wash, dry. Alright, we're gonna start the exam by doing a generalized, just visual assessment of skin, noting the color. I'm gonna take a peek at his head, looking at the contour, make sure things look symmetrical. I'm gonna take a visual look of his hair, skin, then I'm gonna palpate. I'm gonna feel for any tenderness, masses, looking at the skin for any breakdown. If anything hurts at any point, please let me know. Can you look at me? Can you wrinkle your forehead for me? Good. Can you smile for me? Good. Can you stick out your tongue for me? Perfect. I'm just gonna take a peek at your ear. Tell me if there's any tenderness anywhere. Your ear. Perfect. Can you look straight ahead? I'm gonna take a general look at your neck, making sure your trachea is midline. Make sure that I'm not seeing any visual lymph nodes that are swollen. I'll then assess the lymph nodes. Great. Just gonna take a quick assessment of your thyroid gland. Good. Get it back of your neck. I'm also palpating, just checking the warmth of his skin. Alright, look at me please. Look at your eyes. Good. Alright, can you close your eyes? Just try to check to see if I can open them by pulling. Same thing. Good. Look up just a little bit. Nose symmetrical. Can you take a breath please? Great. Can you take another breath? Good. I'm gonna block this ear gently, and I'm gonna whisper something into your left ear. And can you please repeat what I whisper?
There are 5 cats in a tree.
You don't have to whisper it back, sorry. Alright, I'm gonna block this ear and say something else.
2 dogs in the house.
Good, thank you. Alright, I'm just gonna grab my flashlight. Which gets stuck. Hold on. Alright, I'm gonna have you just look straight ahead. I'm gonna check your pupil response. Excellent. Perfect. I'm gonna have you just look over the bridge of your nose straight ahead. I'm gonna check your corneal reflexes. Light reflex. Perfect. Alright. I'm gonna have you look straight ahead at me. Do not move your head. I just would like you to follow my finger with your eyes only, okay? Good. Perfect. Alright, now I would like you to keep your head straight ahead looking at my nose, and I want you to tell me when you can see my hand coming.
See it. See it.
Look straight ahead of my nose.
See it.
Good.
See it.
Okay, thank you. I'm just gonna check your carotid pulses, okay? Excellent. Excellent. Okay, so everything's symmetrical. There's no malformations, no skin breakdown, great. Sit nice and tall for me. Good. Can you tilt your head down to your chest? Good. Can you put your head backwards? Great. Can you have your ear touch your shoulder? And your other ear touch your shoulder? Good. Now I'm gonna have you, can you try to turn your head this way? Good. Can you do it this way? Good. Can you try to tip back? Excellent. And then tip forward. Good. Can you try to shrug your shoulders up against me? Good. Symmetrical movement. Any tenderness?
Nope.
Good. Put your arms out. Good. Are you able to bring your arms back? Can you put them behind you? Good. Bring them forward. Any tenderness?
Nope.
Good. Put your arms straight out. Can you lift up? Good. Can you lift down? Perfect. Equal strength. Alright, can you actually hold my hands? Can you give me a squeeze? Good. Can you make a fist? Good. Can you put your fingers apart like this? Can you bend your knuckles? Good. Any tenderness?
Nope.
Good. I'm just gonna assess your arms real quick. Skin looks great, normal hair growth. Skin looks great, normal hand growth, fingers look fine. Are you able to push up against my hand? Good, just with your wrist, sorry, you can lower your hand. Can you bend your wrist up and down like this? Good, can you still bend it up? Good, can you bend it down? Good. Same thing over here, can you bend your wrist up? Can you bend it down? Good. No tenderness?
Nope.
Great. I'm just gonna check your cap refill for each finger. Good. Skin is warm and dry, there's no clamminess. Good, in between the fingers, there's no wounds, no skin breakdown whatsoever. Can you do me a favor, can you take your hands and rapidly move them like this? Can you do it with your eyes closed? Perfect, alright, stop. I want you to close your eyes and let me know if you feel me doing something, tell me what it is.
Move my middle finger.
Perfect. Alright, you can open your eyes. Can you take your thumb and touch your pinky fingers? Good, can you do them all? Perfect. With your hands out, can you close your eyes for me? Perfect. There is no drift at all. Excellent. I'm just going to take a quick appearance. Normally his shirt would be off for a physical exam, but I want to just take a look at his chest, making sure there's no skin breakdown, noting the color, make sure there's no pulsations, and make sure that chest expansion is equal bilaterally. I'm going to assess his back as well. Can you scoot forward just a little bit, please? Thank you. Same thing, I do a visual assessment first, then I would palpate the skin, making sure that I'm not noting any deformities, pulsations, lumps. Do you have any tenderness anywhere?
Nope.
Great. I want to put my hand here over your kidney. Let me know if you feel any tenderness.
Nope.
Good. Any tenderness?
Nope.
Perfect. I'm just going to take a listen to your lungs. Take a deep breath. Good. 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 Deep breath in and out. Good. And again. Good. Deep breath. Good. And again. Excellent. Once again, I'm going to palpate for any tenderness, any pulsations, any abnormalities. Everything looks good. Take a deep breath. Good. Again. 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 And again. One more. Alright, I'm going to have you lean forward. Just going to take a quick listen to your buccal pulse. Good. Your buccal pulse sounds great. Normal rate. I just want to check the lymph nodes right here real quick as well. Lymph nodes don't seem enlarged. Perfect. I'm just going to take a listen to your heart sounds, okay?
Okay.
Julia, can you see what I'm doing from your angle?
I can come to the front.
Huh?
I'll come up to the front.
Okay, thank you. Good. Heart sound great. I'm just gonna feel for any pulsations, any tenderness at all.
Nope.
Good. Awesome. Can you, while you're sitting, I would like you to take the heel of one foot and bring it down the shin of your other foot. Great, can you do it with the other one? Perfect. All right. Just turn everything. 1 second. Can you close your eyes? Let me know if and when you feel this.
Feel it. Feel it. Feel it.
He would normally not have pants on.
Feel it. Feel it. Feel it. Feel it.
Okay, good. Thank you very much. Can you please keep your eyes closed for me? I'm going to place something in your hand with your eyes closed. I'd like you to tell me what it is.
Key.
Great. Keep your eyes closed, please. I'm going to place something in your other hand. And can you please tell me what the object is?
Pen.
Excellent. All right. Can you stand up for me? All right. I'm going to have you walk a few steps towards that side of the room and then turn around. Great. Turn around. Now, can you walk heel to toe back to me, please? A couple steps. Perfect. You stop there. Can you take a couple steps on your toes? Excellent. And can you take a couple steps on your heels? Great. Normal balance. I'm going to have you, if you can, bend forward, please. All right. Normal curvature of the spine. Great. Can you bend backwards for me, please? Any soreness at all?
No.
Great. Can you swivel? Great. And can you tip side to side? Great. Movement is great. Now I would like you to carefully raise one foot up and then bend your knee on the other foot. Perfect. Can you do the other side? Great. And then with your eyes closed, can you put your hands out in front of you and just stand with your eyes closed for a moment? Perfect. Can you bring your hands out like this and stand with your eyes closed? Perfect. Balance is excellent. All right. Can you climb up on my improvised exam table? Can you lie down for me, please? Would you like a pillow, Mr. Shrest, for comfort? Very good. All right, excellent. All right. So I'm going to do a visual exam of his chest and abdomen. I'm looking for any excessive hair growth, any skin problems, any discolorization, any breakdown, any wounds, any deformities. I'm looking for symmetry as well. So I would complete my visual assessment. Everything looks good. Next, I'm just going to take a listen of your abdominal sounds. Great. I'm also going to take a listen to your aorta. Perfect. At this point, I would also have him lean slightly on his left side and also take his heart sounds from the apex, but because of the position, I'm sort of going to skip that part. I'm going to put my stethoscope here and listen though. All right, I'm just going to tap lightly on your belly, okay? I'm going to do some percussion. Noted, you're doing great, thank you. Now I'm going to palpate lightly, okay? Let me know if anything's tender. Any tenderness noted?
No.
Skin is nice, warm, dry. Skin looks great. No tenderness noted. I'm gonna first inspect his hips. I'm looking for symmetry. I'm looking for skin breakdown, skin color, temperature, any excessive hair, any malformations, etc. Everything looks great. Do you have any tenderness at all? As I palpate it?
Nope.
Nope, great. Same thing with the legs. I'm just gonna inspect visually first. I'm looking for symmetry. I'm looking for skin color, breakdown, hair growth, noting any malformations. I'd also palpate his legs, looking for any tenderness, anything. Look at his knees. Everything's great. I'm just gonna palpate popliteal pulses. Great. I'm gonna palpate posterior tibials. Great. +2 normal. Same thing with dorsalis pedis. Pulses. Normal pulses. Easier to feel without a sock on, but we'll wing it. Great. I would inspect each toe individually. I would look in between each toe to make sure that there's no skin breakdown or any wounds. Same thing over here. I'm going to check cap refill on each individual toe. Same thing here. Check cap refill on each individual toe. Can you push up on my hands? Great. Can you push down? Good. I check a Babinski response on each foot. Good. Can you lift your feet up toward the sky? Nope, sorry. Can you bend your ankles up? Good. Can you push them down like you're pushing? Perfect. All right. I'm gonna have you lift this leg straight up in the sky like you just did. Great. Are you able to bend your knee up towards your chest? Perfect. Can you bend it out? And can you bend it in? Perfect. All right. Can you put your leg flat again? Can you push up with your whole leg? Great. Push up again. Good. Can you lift with your leg raised, push down? Perfect. All right. Same thing with this leg. Raise it up towards the air. Good. Can you bend your knee up towards your chest? Can you rotate it in? Yeah, out and now in towards me. Good. Can you lay it flat? All right. Can you raise that leg up for me? Good. And can you push down for me? Excellent. Any tenderness?
Nope.
Good. Good range of motion. Good muscles. Can I just borrow your wrist real quick? I don't know if I checked your radial pulse, so I'm just gonna feel your radial pulse now while you're lying here. Great. I'm gonna check your brachial pulse. Good. I see this wrist. Radial pulse. Excellent. Brachial pulse. Excellent. All right. Can I have you just swing your legs over real quick? Good. Can you bend your knees in? Yeah, you can just do that. Good. Can you bend them out? Perfect. All right. Can you bend your knees out, pushing up against me? Oh, good. Can you push them back? Good. Pretty much with all the range of motion muscle exams against resistance, everything is equal bilaterally. So that's good. Let me think. I'm going to just take a quick peek at my notes, and then I'll let you know if I missed anything. Actually, can you hop down here for me real quick? Take a seat. You might need to come down so you can see what I'm doing, or you can turn a little bit. Can you turn in the chair a little bit? Can you open your mouth for me? I'm just going to look at the inside of your mouth. Good. Excellent. No broken teeth. No swelling. No wounds. Can you go ah for me? Good. Can you stick out your tongue and go ah? Excellent. Good. Can you try to open your mouth? Can you clench your teeth for me? Good. I'm gonna try to open it with. Excellent. Can you open your mouth? Good. Can you close it? Can you open it again? Try to zigzag your mouth. Excellent. Feels good. All right, Mr. Shiras. I think we are good. Thank you very much.
Anytime.